If you're looking to figure out the best things you can do right now at home in order to make yourself the most resilient you can be, then you've come to the right place. Whether it's Lyme disease, coronavirus, influenza, or anything else that you can matter, even recovering from diabetes or heart disease, we're going to be addressing all that today here on Second Wave Survival Series. Today I'm going to be joined by my really good friend, Dr. Darin Ingels. He's a naturopathic physician. He's the author of the Lyme Solution, which is a 5-part plan for overcoming chronic illness. And as you'll learn, it's not just going to be about Lyme disease. It's going to be about how to really optimize your health overall and be the most resilient host that you can possibly be. Basically, making yourself as naturally bulletproof to any of these outside things like Lyme disease or COVID-19, so that if you do happen to be exposed to them, you're going to have the best chance of having a great outcome. So really excited for this episode, and let's dive right in with my buddy, Dr. Darin Ingels. Hey, Darin, thanks so much for joining us today. How's it going?
Hanging in there like everybody else, right? We're living in very interesting times. I'm actually kind of excited because here in California, we're finally at a point where things are starting to open up again. We're starting to see people out at the beaches, getting vitamin D, getting some fresh air. People still being very cautious with social distance and masks, but it's at least nice to see our community start to come back a little bit.
Yeah, it's so key. And, I think that's one of the reasons I really wanted to have this conversation. I'm over here in Connecticut and get kind of isolated, and then you're on the other end of the world, so kind of a good check on what's going on. But, what's been going on in your community though? Because for me, there's so much information out there that's just over the top, and I'm always trying to cut through so that people can chill out and stay healthy. But what are you seeing out there?
Well, I think what we're all seeing, I don't think it's unique to our community. I think you're seeing it probably in your community as well, and really around the world, is just a lot of fear. We've got fear that I always feel like I'm constantly having to talk people off a ledge because there's so much misinformation that's being spread, whether it's through social media, mainstream media, wherever, their neighbor, that people are just really confused. And so they're not quite sure what they should be doing, what they shouldn't be doing, how they best protect themselves. So, educating people, one-on-one in my practice, or, trying to go online and, tell people the truth about what's going on and how to best, care for themselves and their family. It's been really challenging. And I think, the best that, you and I can really do is to try and really help educate people about, particularly with COVID-19 that's been going on now since, the last 5 months. On how to, really, best protect themselves. But I've just been kind of amazed at the amount of bad information that's being propagated, particularly even from people who I think, are knowledgeable and well-respected. I think, everyone's getting a little piece of information, and there's still so much about this virus that we're still continuing to learn about. But, I think the fear breeds so many other problems for people. It's creating anxiety, it's creating stress, it's just generally having a negative impact on people's lives. So I think the more that we can really help educate people about the truth, that alleviates a lot of that fear, a lot of the anxiety. People are sleeping a little better at night. They're able to interact in the world again in a more healthy way. And, I think that's been one of the most positive things I've been able to do, at least in my practice and with my community.
Right. Well, I think for me, it totally highlights something so important is that fear thing. And I've been saying you look at the information that's coming out, right? And it's just rapid fire and hold on to your pants because whatever is going on today with, COVID-19, in 2 days, it'll be completely different. Right.
Right.
And so I just look at that going, man, this is what you and I, with our background, have looked at scientific literature and the data developing over years. It's almost like we're seeing a social media experience of scientific development in real time rather than 5 years after people have been putting all the work in the background in. And I've been saying that I think that does lead a lot to the fear. So And one of the other things, I know you and I have been talking about this a lot through the whole pandemic, but is all the shit we've been talking about since the very beginning, that the actual what you need to do to get healthy is exactly the same thing. The best things you can do to keep yourself safe, those are the things that still hold true. And I know I really want to dive into those, because I know that that's kind of at the crux of a lot of what you do, is like what you can do at home and what you can do to improve your health, not just for what you walked in the office for. But before we dive in there, I mean, what is some of the craziest stuff you've been hearing that we need to just, this is fake, false, let's just,
Yeah, well,
kind of like,
I think the craziest thing I've seen, and it was posted maybe about a month or maybe 6 weeks ago, was that if you sneeze, your sneeze can spread 27 feet, and that's going to get somebody sick. And so I saw the link, and I'm like, okay, that doesn't sound right. And I said, let me keep an open mind. Maybe there's something I don't know. So I clicked on the link, and it was a Japanese study where they literally put someone in almost a vacuum, a box. They put some sort of fluorescent dye in this guy's nose and gave him like pepper, something to make him sneeze. And then they were able to trace the particles as far as they went. And it was a very long box. And apparently the last particle they could measure went 27 feet. I'm like, well, that's a little misleading though, because if you look at his sneeze in real time, almost all the droplets go really not more than maybe 3 feet, and they fall to the ground almost instantly. So that 0.000001% particle that happened to make its way 27 feet is insignificant. And so, if you just go by the headline alone, you can see, wow, if someone's 27 feet away from me and they sneeze on me, I'm going to get COVID-19. And it wasn't replicating reality. It wasn't replicating real life, where there's wind flow, airflow, all these factors that affect how droplets, move.
Yep.
And so it was one of these things that, it got kind of a hot button, clickbait, just because it sounds really scary. And again, I think this is the kind of stuff that we've had to overcome, because, you're not taking what really happens. And I think we've seen similar things too, looking at, how long does this virus stay on inanimate objects? Well, it can stay up for 14 days. And again, what they don't look is at viral decay. And yes, is there traces of virus after several days? Yes. Can you get sick from that trace virus? Probably not. And that's it. And so again, I think, the data is constantly changed, and Dr. Fauci, and the World Health Organization, the CDC, all these big public health people who are very prominent, the information keeps changing. Wear a mask, don't wear a mask, do this, don't do that. So the conflicting data is kind of added to it. But I think you have to be cautious, as I said, when you're reading through all this material and you see these headlines that sound really scary. You need to investigate and have that conversation with your doctor. Does this sound right? Is this real? Because again, it's sort of an extrapolation of the truth. And when you look at the actual data, you're like, okay, yes, technically there's a particle. Can you get sick from it? Really not. So, that's I think that's the craziest one I've seen.
Yeah, I mean, I think that, and the fact that we don't know really what's going on, and then we look to our leadership, and it's like we're not getting a clear message, and it's tough. And then one of the craziest things I heard about was, like, somebody sent me a video about how we have a fake pandemic. It's fake. Yeah. And I said, well, I don't know that it's fake. I mean, I actually know some people who are no longer alive from this, and I know a lot of people who've had it. I also know a lot of docs who still work in the hospitals and the ER, and it's a real thing. But then I watched this video because I wanted to be open to what this other person had been saying. And they go, oh, well, this was made up. And I'm like, okay, well, maybe if it was man-made, that might, that's different than fake. I mean, it was like the way it was twisted by the viewership. But then the problem was, the video goes on to talk about making this an anti-vaccine problem, and they developed it so that everybody had to get back. And I was like, and not to dive off the deep end in that, but to me, it's like we get distracted. Like you use the term clickbait. I mean, there's so much stuff going on that it's so hard to focus on what we really should be focusing on, like how to. I break it down to two things, and I hope you'll take us there too, because I know you think this way too, but we have a virus, and there's certain things that can be done to maybe prevent us from getting the virus, and we might be able to have a medical treatment, but then we have a host, and the host is us. And for me, I want to be the host, right? I want the virus to see me and run away. Right. So, I mean, what are the things that one, are there things that are effective in one, making us a really bad host, and then also for moving us in a place where if we did get the virus, we might be able to, knock it off.
Yeah. Well, again, I've been saying this in other, podcasts and interviews. We have this saying called going viral for a reason. This is the nature of what a lot of viruses do, particularly respiratory viruses. A lot of respiratory viruses, they have varying degrees of how infectious they are, but by and large, a lot of them are infectious. And, I saw a great interview with Dr. David Katz out of Yale. I don't know if you know Dr. Katz. He's a really, I think, very knowledgeable, well-articulated public health doctor. And, his comment, and I agree with him, is that, everything that we've done since, COVID-19 came out was really to kind of slow the rate of transmission, but ultimately you're not going to stop the virus,
Right.
And so, now that we're opening the world back up and we're seeing cases go up again, I'm like, well, of course we are, because now people are interacting and viruses do get spread amongst people in various ways. So, the goal was never to stop the virus. The goal was really just to take the burden off the medical system so it didn't get overwhelmed. But inevitably, this virus now, it may have a natural cycle where it becomes less virulent and it just kind of peters out.
Right.
Based on history of other coronaviruses, I think it's a high likelihood that the virus is here to stay, and it may become a normal seasonal variant like influenza and some other respiratory viruses.
Right.
We don't know yet, but the idea that you can stop the virus completely, it's never happened in the history of mankind. If that was the case, we wouldn't have influenza every year.
Right.
So,
well, it's interesting, Darin, that you bring this point up, and I think we need to really drive it home, is that the purpose of social distancing is not to not get the virus.
Right.
It's to delay, to bring the numbers. It's how many people at a given time have it. We're all either going to get it or not get it, and staying home, unless you lock yourself up forever and never come out, never see another human, you're not going to, because every day people are asking me, oh, is it okay to do this? Am I going to change my risk? I'm like, well, yes, you're going to change your risk by leaving your house, but you can't live in your house forever. And that wasn't the point.
Yeah.
I think that
we have an immune system, and, the immune system learns by recognizing things that aren't us. And this happens from the time we're children, from the time we're infants. And, the reason, infants, toddlers, they put things in their mouth. I mean, a lot of that is sort of, behavioral. It's a normal development, but to a degree, it's also inoculating us with these various things in our world to teach our immune system, this is part of my world. And we get exposed to numerous germs over the course of our life. And again, that exposure to a certain degree is not a bad thing, because again, it does keep our immune system primed. It helps recognize what's us, what's not us. There's been this question that's been asked recently, and I don't know the answer, is, by people having shelter in place and not having all that ongoing exposure, is that in any way compromising our immune system, because now we're not getting that day-to-day exposure that we've had in the past? I don't know what the answer is yet, but I think it's an interesting question that we need to think about, because again, if you're talking about how do I become the worst host possible for a virus, I think part of it is having our immune system as optimal as it can be. And, I think we'll dive in next on what some of those things are, but, that interaction in the world really is important for us to keep our immune system healthy too.
Yeah, it's interesting when you say, because I have sort of, I'm a big believer in my gut reaction, because I've spent a lot of time paying attention to what my body teaches me and what it's saying, and also try to validate that, because sometimes my body's like, oh, I want to have 6 beers and a can of ice, a tub of ice cream. Well, probably that's not what my body was really saying. But I mean, when you really listen to it, I mean, so what comes up for me is, I think that there's a degree of people relaxing a little bit, and being able to get a little more sleep, maybe taking a little of the big pressure off of work a little bit, and maybe just calming down a little bit, so that then we have this opportunity to boost our immune system. And, a couple months away from massive exposure all day long probably isn't going to knock it down. But on the other hand, you make me think. I'm like, well, people are more stressed about this than anything they've ever been stressed about. If they lost their job, now they're really have huge stress.
Right.
And we're all confused. So, I mean, I think that the de-stress stress thing here could play either way. But I think our immune systems probably are happy to have a little vacation, but I don't think we can do this forever, because then we'll just be like Bubble Boy, you know?
Yeah, well, like I said, a little vacation is probably good. And again, for someone who's truly immune compromised, them sheltering in place is obviously the safest thing for them. But for people who aren't in that category, again, if you believe in herd immunity, you want the herd to be exposed. The herd being exposed, developing natural immunity where they either get no symptoms or they get, sick, but not detrimentally sick. That helps build natural immunity to the virus, and that ultimately protects the more vulnerable people around them.
Right.
So I think, again, what we're going to see as the world opens up again, that hopefully, that healthy group of people, they're going to have that exposure. We're not clear yet whether you develop any kind of long-term immunity with this virus or not. Science so far as I read, seems to suggest that it does seem to protect you, at least short term. And a lot of these respiratory viruses, again, if you get influenza, if you get the flu, you're not immune from getting the flu again. I mean, you can get it because the virus mutates, it changes. And again, we may see the same thing with this coronavirus, but again, we don't really
Who
know.
knows? Well, so this brings up a thing. Like I hear, a lot of people are looking to get, we hear about the herd immunity. Everybody's talking about it, and then the problem being, I think a lot of people think that 60-70% of people are going to get this, and then nobody's going to get it again. It'll just fizzle out, and that's not really the reality. I mean, but there's like, can you talk, like, there is this sort of concept of sort of like immune memory, versus full on immunity, and I mean, I can think of nobody better than somebody not only who's a doctor, but also has a microbiology background to ask to explain this a little bit more.
Yeah. Well, when you get exposed to different, particularly different viruses, there's a reason that we don't develop long-term immunity to influenza. It's an RNA virus. Again, it's rapidly mutating. So really every year what your body sees is something a little bit different. It's genetically not the same thing we had before. And with influenza, we have different strains. We have influenza A, influenza B, and by and large, it kind of tends to flip-flop, some years A, some years B, and so forth. But because of that natural evolution of the virus, the immune system, tends to target very specific parts of the virus. And the same thing with bacteria or any other type of pathogen. Your immune system recognizes, hey, that's not part of me. And that's what it starts to make antibodies against. So this long-term immunity we get, say if you get a vaccine for measles or mumps, there's a protein in there that gets recognized. You now make antibodies against that protein that's unique to the virus, and that's what gives you the protection. So if it keeps changing, whatever antibodies your body made that 1 year, now that protein might have changed. It's not the same thing. So therefore, when you get that secondary exposure, it's almost as if it was something completely brand new. So again, with this particular coronavirus, again, it's too early to know how that's going to pan out in a year or two. I think, our best example we have is when H1N1 came out in 2009, the swine flu. It caused, again, a pandemic at the time, not to the degree that this is turning out to be, but again, it affected millions of people. A lot of people got sick, a lot of people died. And yet now we see H1N1 as a seasonal variant of influenza. So it's still around. It didn't go away completely. It doesn't affect people the way it did before. So again, whether this particular, SARS-CoV-2 will be a normal seasonal variant, we'll just kind of have to wait to see. Is there going to be another second wave of this thing coming? We don't know. I know they've been trying to equate this to the Spanish flu of 1918, where they had the initial wave, which wasn't bad. The second wave came in the fall and was much deadlier than the first wave. There was actually a third wave in the winter of the following year that was also fairly deadly. So we're trying to compare it. I think when all is said and done, we're going to find that the numbers of this are not going to come even close to Spanish flu. Spanish flu killed 50 million people. We won't be anywhere remotely close to that, thank goodness. But, there's a lot of speculation on, how this virus is going to change. I think what's interesting is at least some of the initial research, when you look at the virologists who've been studying it, is they do seem to suggest that it is changing fairly rapidly genetically. So whether that's good or bad or indifferent, we don't really know yet, but it does seem to suggest it's mutating fairly rapidly.
Right, but again, it's an RNA virus, so its replication is fraught with errors, which leads to mutation. But is that one of the reasons why, we may have a very virulent strain? It's causing a lot of damage, so to speak. It's high potency, if you will, and then like in a season or two, we're seeing it's just kind of a variant that we almost forget about because it's so mild. I mean, is that part of that, or?
Yeah, and there's a concept in immunology or in virology called antigenic shift and antigenic drift. And what that
Yep.
means is that every influenzas, again, are sort of poster child for this, is that it goes through what's called antigenic drift. That's that every year it drifts just a little bit genetically. It's not quite the same. And again, that's why people who are prone to getting influenza can get it every year. Then about every 10 years, it goes to what's called antigenic shift. That's a major, major mutation in the virus,
Yep.
at which point that's where you get an epidemic year.
Like
So
the bad flu year.
the bad flu years, and that happens
Yeah.
about every 10 years with influenza. So, that's very common to RNA viruses that they go through these kind of mutations. The rate at which they mutate, that does vary quite a bit from virus to virus. But, a lot of people don't realize that up to 15% of what people get every year as flu-like symptoms is a coronavirus, not this
Right.
specific one, but a coronavirus. So there's other types of
Right.
coronaviruses out there. Again, coronaviruses are not new. They're not man-made. They've been around for a long time. So again, whether this virus will mutate its way to become more virulent, less virulent, we don't really know yet. I think, what's encouraging is, even though if you look at some of the places that have opened up earlier in the United States, even though it's opened up and there are more cases, we are not necessarily seeing more hospitalizations and more deaths. So I
Right.
think that's encouraging that maybe this thing's on the kind of the tail end.
So I mean, is this like, so the coronaviruses outside of the SARS-CoV-2 cause about a third of the common cold, right? So is the reason that we can't really treat the common cold and we don't really have good influenza treatments because it mutates so much, or?
Yeah, exactly. And again, I think if you look at flu vaccines, especially over the last decade, when you look at their effectiveness each year, I mean, it's poor. And again, I suppose we could have a long talk about what do you consider an effective vaccine? What percentage of people does it have to help? But I remember
Right.
one year was 13%, one year was 8%. Last year it was all over the place in terms of what they were reporting. And it's very hard to know, because if you get vaccinated and you don't get the flu, is it because you just weren't going to get the flu naturally, or because you were vaccinated? So
Or if you get vaccinated, yeah, it's like some of these people go, oh, I got the vaccine, but I got the flu, but they never got tested. They just had a cold.
Right. And that's the other problem when you look at these numbers, is that, a lot of times if you go to the doctor and you've got flu-like symptoms, they'll say you've got the flu. They may or may not do the swab to test you to confirm it. And again, for most people, flu-like illness is annoying. It's mild. There's really no treatment for it. So they send you home, tell you to rest, push fluids and so forth. So, I think part of the reason that, well, certainly for cold, there's very little motivation, I think, for companies to develop a vaccine against the cold virus. And with cold viruses, which are rhinoviruses, they're a different category. There's numerous different rhinoviruses. So to find one vaccine that's going to cover all of them because they're genetically different, it's just very challenging. And, in the decades, however long we've been studying, flu vaccines or influenza, we still have flu every year. So we haven't demonstrated that we are very effective at eliminating RNA viruses vaccinations. But in terms of how effective the vaccine can be, by and large, the influenza vaccine has not been very successful the past several years.
So you and I are kind of funny chaps to be talking a lot about vaccines for anybody who knows us that well. But I think it's important to understand it's not, whatever I make a decision, I want it to be based on as much fact as possible. Right. So that I know both sides, as much of the science as well as as much of the personal stories behind things, so that I can really make a really good decision. And the benefit of what we do, like a lot of what you're hearing on the news right now, we're talking about what we should do for the general population.
Right.
And then we're kind of just juxtaposing that with what doctors are having to do with a unique individual in front of them. And those two things are separate. So what we do in our practices are really to work on, we're having an individual relationship with a person or a couple or a family. And that's different than making a decision for the whole country, which is great.
Well, I think you and I both kind of pride ourselves on individualized medicine, personalized medicine. You have to look at all of the factors of the individual for whatever decisions you're going to make about their health care. And again, I know from a public health standpoint, you're trying to look at what affects the public as a whole. And it's really hard, if not impossible, to take into consideration everyone's individual needs. We have the advantage of, working with patients, working with families to be able to sit down, look at all these external factors, what's influencing their health, and then what can we do to help, reduce those risks, improve health. And, you and I were talking before we jumped on camera here about, I kind of laugh, that, I wrote a book, Terry Walls wrote a book, Amy Myers wrote a book, and we kind of look at the crux of our books. We keep repeating a lot of the same things because these are foundational.
Green screen.
These are foundational issues of how you maintain good health. And ultimately, I think that what that translates to is a healthier immune system.
It does, and so this is what's really interesting to me about the whole vaccine conversation, because I wanted to ask you one other question about that before we dive into the stuff that you were just talking about. But the idea behind a vaccine is to get an immune response.
Right.
Which assumes, in my mind, that if you were to, like, for the sake of argument, want to have a vaccination, believe fully in vaccination, I would think that when you got vaccinated, you would want to be have the highest immune function you could have your body working as optimally as possible to have an optimal response.
Right. Yet
when we do vaccinate people, we're just like, here's like 17 vaccines, and as long as you're not febrile, you don't have a fever, you're good to go. I mean, it's just crazy. It makes me wonder. But with a vaccine, like, let's say COVID-19 has an okay vaccine.
Yeah.
For the sake of argument, from a microbiology, virology perspective, what would be the benefit to, like, the country if we were to have a vaccine?
Well, I mean, I think it's the same as what we see with influenza. I mean, ultimately, if you have a successful vaccine, that means less people who get ill, or it may even mitigate the depth of which the illness affects you. So there's a difference between ending up in a hospital on a ventilator versus getting, flu-like symptoms or a bad cold. So even if it's not completely successful at eliminating symptoms, if it at least helps reduce the severity of the symptoms you do get, that could be the best possible outcome. So ultimately that translates to less hospitalizations, less death, less, morbidity, in a perfect world. I mean, this is the complication of influenzas, that you can develop, into pneumonia, it can put people in the hospital, and ultimately, people do suffer. I think, again, the parallel with influenza is that, people that have these underlying comorbid conditions, elderly people who have a compromised immune system, they are the more vulnerable to these viruses. And I think the conversation that no one's really had when we talk about the vulnerable population is that you're not just vulnerable to COVID-19, you're vulnerable to everything.
Right.
So if you're really in that category and you're worried about COVID-19, you should be equally worried about seasonal flu. You should be equally worried about all these other things you get exposed to, because they're out there in the world. So, it's always a tough trade-off of how you consider, how you interact in your own life versus protecting those who need to be protected. But I mean, this is kind of the reality, is that when the immune system is compromised, anything can affect you. Outside of COVID-19, I mean, at one point, COVID-19 will peter off. It'll go away. At least it won't be what it is. But there'll be something else. And whether it's the next flu that comes along, whether it's some virus we don't know about yet, there's always going to be something. So again, it's in our nature as humans that we interact with each other. We get exposure. We spread germs, either intentionally or unintentionally. It just happens. So I think, we collectively, and certainly as public health people, need to think about, again, what is the best way strategically to help protect those who are most at risk without necessarily, affecting the rest of society.
So and for me, one of the reasons that I really wanted to do this and jump on, and have these discussions and get them out to people was because I believe that a lot of what you were just talking about, Darin, is we can control our destiny. We have a lot more control over our health outcome than we think. And so, and I know, I mean, crap, when you read the book, I mean, it's so funny. Like, we're having a good time playing with our green screens today for fun. But, and if you want to be really crazy, you can do stuff like this. But I'm liking the coffee shop vibe. But
yeah.
But the idea is like, so Darin's book is The Lyme Solution, and he's got a 5-part plan in here. But it's interesting. You go on to say to fight the inflammatory autoimmune response and beat Lyme disease. You didn't say beat Lyme disease or do this or that. What is like? And I look at your book as it's one of the best books on Lyme, period. But most importantly, I think it's the best action plan. And so I really wanted to, when I read this, I think, man, this is like the COVID-19 solution, right? So what are the things that you really think are like everybody listening really can do at home? How much control do they really have over their health destiny? And I think you're right. Like we talk a lot about the second wave. I mean, even talking about, the whole series, calling it second wave survival, because I know that it doesn't matter whether it's Lyme, it's influenza, it's COVID-19, or if I'm kayaking and I spill in the surf, or I take a digger going down the mountain skiing, there's always the next thing is coming to smack us in the face. Right. And I really like the way you put it. COVID-19 could go away, but you still have a body and you still have a life that you can live optimally, and you're going to have other challenges. So what are what are the most important things that we need to be checking out and we need to be working on?
Well, you and I both studied with Michael Burnoff, and, he's talked about this a lot in his podcast. And I've appreciated that, we have this opportunity, given everything that's going on, to really make choices. And I hope that everything that's gone on has kind of woken people up that don't wait for a pandemic to take stock of your health. And, right. For those who have been, at home and maybe they haven't been working for whatever reasons, there is that opportunity to really pay attention to what you need to do to have a healthy body. And, there's choices to be made, and it comes down to, making choices that's right for you, right for your family, and ultimately is going to translate to better health. So, if you've been overweight for a long time and you need to drop some pounds, you can choose to sit at home on the couch and eat, Twinkies all day, or you can say, hey, look, I got extra time.
They're back on the market.
Yeah. Or I've got extra time to go out with my family and take a walk or take a family bike ride. Or if I'm in an area where I can go hiking, maybe I'm going to get outdoors, get some fresh air, some vitamin D. So, we were positioned in a space now where, we've got that opportunity, I think, to take advantage. We all complain about time, right? We just don't have enough time to do the things we really want to. And, even in my world, you and I have both been working, but our practices are very different than they normally are. I'm a little bit slower than I was. I have a little more extra time. So I've been trying to take advantage of that time, again, to do all these things that I've always complained like everyone else that haven't had time to do. So I think it starts with the foundation stuff. I talk about it in my book, but it's diet. Diet is huge. Your gut comprises up to 80% of your immune function. So if you're eating crap all day, ultimately that can have a negative impact on your gut function and ultimately your immune function. So again, here's your opportunity to start making better choices about what you feed yourself and what you feed your family. So diet's huge. Sleep, getting good quality sleep. You and I have talked about this in a previous webinar, that the whole concept of autophagy, your body's ability to get rid of all of these cells that are basically damaged and dying. A lot of that happens when you get into your deep sleep state. We know that your brain detoxifies when you're in deep sleep. So the more good quality sleep you're giving your body every opportunity to stave off all these different things we get exposed to. And we know from sleep studies that when you are sleep deprived, there is a toll on your mental health and well-being and your physical well-being. So
what's crazy,
3 hours a night doesn't do the job.
No, and a lot of people are like, hey, you know what, man, like my dad or my mom had Alzheimer's, or I read about, like, I don't want to get dementia. I'm like, well, great. You know what? The best thing that you can do to not get dementia is the same things that will help prevent you from having a bad outcome when you get exposed to influenza or COVID-19 or Lyme disease, for that matter. It's all the same stuff.
It's all the same stuff. Again, look at our Lyme population. How many people do you see that get Lyme that's relatively mild, or they clear it fairly rapidly, and other people that are debilitated? What is the difference? If it's the same relative organism, there are different strains of Borrelia, so they could be a little different. But by and large, why is there such a gross difference in how it affects people? And I think, again, it comes down to the host. The microbe might be the same. And again, we could say this about any bug, any virus, any bacteria. Why does strep throat affect people different way? Why do ear infections affect children different ways? If it's similar organisms, what's the difference? So
Right.
again, I think this is where we have to look at the individual. I'm sure, genetics certainly play a role to a certain degree. That's a little harder to tease out. But when you look at diet and lifestyle, environmental exposures, all of these things, have a total load on your body. And the more that we can reduce your load, and particularly for toxic things. I mean, I talk with my patients, I'm sure you do too, about, get all the garbage out of your house, all the toxic chemicals, all the toxic, things you use to clean your bathroom. It's just another thing that adds to the load. So the more that you can reduce your total load of different toxins, again, it gives your cells a chance to repair themselves and gives your immune system a fighting chance.
Yeah, it's so much wisdom there, because I think that a lot of us are going to go like, hey, I already do that. I do that. And I'm like, well, have you really taken people tell me that, and I'll be like, all right, give me a food diary and give me a cleaning product diary. And it's like, it never shows up. Well, I remember a couple of weeks ago, I was talking to a patient and he goes, you know what? I never realized how much I ate out. He goes, I have saved so much money with COVID-19 and being home. He's like, I didn't realize it. And it's not, and, he's fortunate enough to be able to work at home and everything. So he's still got money coming in. And I get that that's not the case for everybody. But, what's really crazy about it is we had this conversation. I'm like, well, part of your weight thing and your energy levels that are all tanking is probably because you're having too much processed food, and he's like, no, it's clean. My diet's so clean. I'm like, so use these times to take an inventory, right? And so and I hear the sort of the good cop, bad cop on my shoulder, the devil and the angel thing going, hey, well, I get it, but it's like, I had a great diet, but I still got Lyme disease, and it sucks. I'm like, well, all right, well, I'm not going to give up, right? And I'm just thinking, like, how much worse would it have been if you hadn't made some steps? And I haven't met anybody who doesn't have an opportunity to see some improvement in their health. I'm not saying that everybody's going to get to, feeling like they're 20 again and like, and they got dealt like the world's greatest genetic cards. But I mean, we do need to get to that point where we can actually give our body half a chance to heal, right?
Well, that's exactly, you just got to give your body that fighting chance. And yeah, you're right. And it's hard because sometimes people do everything right. They exercise, they sleep well, they eat really well, they still get sick, they still come up with some other illness for things. And it's hard to say, you're right, but it could be much worse than what you have now. But again, it's still giving you a leg up on healing. I was taught, and I honestly believe, it is built into our DNA to heal. We just got to get those obstacles out of the way to allow that process to happen. I can't remember who has the quote, but I love it. It's like, we as the doctors, our job is to entertain the patient while the body heals. So we just have to kind of, help things along. But, this is built into our DNA. So again, we've got this opportunity now to, like I said, take stock of our world, take stock of our diet, take stock of how we live our life. Is there changes that we can make, for yourself, for your family, in a more positive direction to have better health for everybody? And that's, I think, the best thing that people can do right now to, keep their immune system primed, keep it as optimal as possible. Is it going to be perfect? No. Are some people still going to get sick? Yes. But can it help reduce your risk? Yes. And particularly if you're someone, if again, if you have some of those comorbid conditions, if you're borderline diabetic or metabolic syndrome, if you're overweight, if you're a smoker, if you've got all these things that you have control over, at least to a certain degree, again, how's that time to take advantage and try and help, overcome some of that.
Well, it's interesting. Yeah, it's so interesting when you look at like COVID-19, the risk factors aside from age, and there are old people who don't die of it,
Right.
but certainly a risk factor, and you may have a little less control. But so much of it are these, what they call lifestyle diseases, the diabetes, the obesity, the smoking, the lung diseases,
Yeah.
and you can change it. But again, like the goal would be to get to this point where we are a host that is resilient and we are living our healthiest life, so that no matter what comes our way, because I gotta, I'm so grateful that you were on our coronavirus mini series where, we're talking about voices of reason, meaning we just wanted to cut through the bullshit and get down to the things that are really going to help people. and also understand that you can, it is stressful. And Mary Morrissey came on and she talks a lot about mindset. And then I got a message on Facebook where somebody was like, thank you so much for having that conversation. And that was really, with Mary in particular, but it was a thread that went through everything that we do on that series. And I know that what you and I do in our offices, because she said, I'm going through this and my dad has to have a surgery, but he's in another country and I can't go to be with him because of this.
Right.
Because of the travel restrictions. And I'm just like, my heart went out, but it was, life happens, and so for us to be resilient, like osteopaths or other people who talk about, the body has this ability to heal itself. And our goal as clinicians, as providers, as well as, the doctor, as well as the patient, is to stimulate or catalyze self-healing and let the body do the work and get the hell out of the way. But we also talk about this body, mind, spirit thing. And I remind people, though, we've got 3 words that are inseparable physiologically. We separate them to talk about them, but if I were to kick you in the shin, you would most certainly have a mental and emotional experience of me kicking you in the shin. And you would have a physical experience, and vice versa, right? So we know a lot of people who have, depression and stuff have pain, right? So it's a continuum. It's all part of who you are. And sometimes people are like, oh, I don't want to work on I can just do the physical stuff. I don't have to do that other work. So, because other stuff's going to happen. Like a lot of people keep calling out, people are getting bitten by ticks now.
Right. Yeah. Now that the world's opening up again, I'm hearing from other people that they're outdoors, and particularly again back in, New England, they said, boy, this is one of the worst tick seasons I've seen in a long time. So I don't know if it has any direct relationship that people haven't been out and about, that's allowed more ticks to make their way out because the natural things that might affect it. I don't know the answer to that, but
we had a weenie winter, man. I'll tell you that.
Yeah. So, I think, again, for those who are in those areas, again, particularly if you're an outdoors person, you enjoy hiking and camping, you just need to be really vigilant and protect yourself. But again, I think it kind of comes back to, whether you're talking about Lyme disease, COVID-19, any kind of chronic persistent infection, these fundamental things that you can do to help improve your health are common to all of it. So again, this is the time to take stock of that and, make those positive changes so that you can improve your health and reduce your risk of getting all this stuff.
So if I were to have if I were to roll in and say, Darin, I've got limited bandwidth, I can do 3 things. I find that if I can get people to do one thing, that's a good thing. But if I were to walk in and say, what are the top, maybe 2, 3, 4 things that I should focus on now so that if there's a second wave of COVID, if I go out and I run into a tick and I happen to get Lyme injected into me or something by,
yeah,
or anything else in my life, what are those things the take homes that I really need to be thinking about?
Well, again, I think diet is the best thing that people do. I think, if you look at the influence of diet on health overall, we know that bad diet leads to heart disease. It's associated with cancer. It's associated with, chronic inflammatory diseases like arthritis and so forth. So we know that it has a huge systemic impact on your health and certainly your immune system. So, I talk in my book about an alkaline diet. What that means is eating foods that really, as they break down, make your cells more alkaline. We know from the research that when your cells are more alkaline, with the exception of your stomach, your bladder, your skin that are very acidic to protect against outside invaders, most of your cells actually operate under an alkaline pH. So that allows the cells to repair themselves, helps your immune system, helps the enzyme systems work the way they should. So again, it's really mostly a plant-based diet with fairly limited animal protein and just eliminating all the junk food and processed food. And again, this is something you have 100% control over. You control what you put in your mouth. So anyone with any budget can do this. It doesn't require any extra help. You don't necessarily need a professional unless you need a little guidance on how to change your diet, but there's a lot of online resources available for that as well. So diet is huge. And I think
you have a lot of stuff on your website, right, too?
Yes, so we have a lot of information about Alkaline Diet. Absolutely. So if people are interested, they can definitely check out the blogs on our website, and we have a lot of additional.
Well, and I think the food thing is daunting, and I think, but there's places to start. I mean, if I were to add, I think there's a removal part and there's an add part. So I think that people often have a hard time removing. But if I were to add one food group or one, sort of family of things into my diet and change nothing else, is there one that really jumps out as I should add it?
Absolutely. Dark leafy greens. Dark leafy greens are really some of the most nutrient dense foods that we have. They're great sources of fiber. You get the water. They're very high in calcium, iron, a lot of vitamins and minerals. So that's things like kale and chard and mustard greens and spinach. So just incorporating some dark green leafy vegetables in your diet. If you've never been introduced to one, I would recommend chard to start with, only because chard is very mild. Kale can be kind of bitter.
Yeah,
Chard
for
is
sure.
very mild. It's going to take on whatever flavor you cook it with. So if you saute it with some, oil and some avocado oil, and then put a little salt and pepper and whatever spices you like, it can actually be very delicious. And again, it's just going to take on the flavor, whatever you cook it with. But if you had to add one food, that would be
nice. And one of the tricks that I use too is in fact, we had a huge tub of kale last night, but I find that also things like garlic and onion with their sulfur content, all their other they have a lot of other benefits. Some people are more familiar with them. It's so easy to cook greens with some garlic and or some onions, and now you can kind of it's not that hard. Salt, pepper, a little bit of proper cooking oil like an avocado oil, like Darin's saying here.
Yeah.
Piece of cake.
Yeah, and even incorporating the brassica family, so cauliflower, broccoli, Brussels sprouts. Again, they're very rich in these sulfur compounds that help raise our glutathione levels, which is an important antioxidant, also important for liver detoxification. And again, I like to saute Brussels sprouts with a little balsamic vinegar and pancetta, and it's delicious. Very easy to make, and again, very nutritive. So again, adding some of those vegetables in can be really helpful.
And another trick too, because I'm glad you brought up the pancetta, because for people who are trying to get introduced, you can also bacon, if you're into bacon, nitrate free and all that good love. But I mean, you can get a little bit of bacon going, and then throw in your greens with your onions and your garlic or whatever else you like. But I mean, use some tricks of the things that you enjoy, right? Don't just start removing stuff. And if you're eating like bacon with all this poison and stuff in it, well, go get some good stuff. But, I think that, I would much rather you see adding the spinach or the chard or the collards than trying to remove your sugar to start with, because we know how hard that's going to be. You got to get rid of that too, but I think that's great. So we've got our food. We're going to introduce ourselves some green leafies, and some brassicas and stuff like that with a little bacon or pancetta, maybe. What else do we need to be focusing on?
Well, I think the next one is sleep. Sleep, again, I think so many Americans are sleep deprived. They're not getting good quality sleep. I think it's our nature now that, we're all addicted to technology. We get home at night after our work day, and that's the time to sit down, answer email, go on our iPad, whatever. We know that blue light that comes off creates all sorts of different problems and interferes with our sleep cycle. So developing good sleep habits, sleep hygiene, commit to getting to bed around the same time every night. I'd say for most adults, try and get in bed before 11 o'clock. We know from some of the sleep research that your ideal sleep time is between 9 p.m. and 3 a.m. That's when you tend to get some of your better quality sleep. We want to get, having deep sleep. If you're open to having, some sort of device that monitors your sleep, like a Fitbit, like an Oura Ring, these can be very helpful if you're not really sure how well you're sleeping, to have these devices that can monitor for you. I like the Oura Ring personally because it's a very low EMF device. And you can set it in airplane mode where it's not really sending signals, but it does collect that information. And again, that can be very helpful. But I find for a lot of people, when they just start getting good quality sleep, they feel their energy's better, their head's clear, their gut's better. Digestion happens when you're relaxed. So for people with chronic constipation, chronic bowel issues, sometimes just improving your quality of sleep can help, your bowel function. And again, all that ultimately translates to a healthier immune system.
Right. And I think it's so important because you're recommending, this is like a medical recommendation. Well, we can't make medical recommendations specifically to anybody right now, unless you're one of our patients, then call us. But the reality is one of the most important medical treatments you can do for yourself is sleep. And I agree wholeheartedly. One of the pieces too, that I found when I got an Oura Ring that was really interesting is I would sleep between like 10:45 and 6:45. That would be my sleep time. And then what I realized was, well, I start going to bed at like quarter to 11 or 11. I'm in bed by 11:30. I fall asleep in 10 minutes, but now it's 11:40.
Right.
And now, and then it's like, next thing you know, I'm getting up and I've only been asleep for 7 hours, but I said I was sleeping for 8. And it was really interesting when I started to carve out time and make a ritual, because a lot of people talk about what's your morning routine, which I think is great, because if you can't sleep, have a morning routine where you get up and do something that makes you get up and get some sunshine, you'll be able to sleep better. But it's like when you actually, Darin, like you're saying, Darin, when you start to measure it, not only do you understand the impact of your foods and maybe your caffeine or alcohol intake, but you start to see that, oh, I'm actually not in bed as long as I thought I was, and it really is. I mean, I feel, I used to not feel good. And so I adopted, and I would sleep 4 hours or 12 hours and feel the same. So I just said, sleep when you're dead. And then I learned more about that. And I met Jill and she was like, hey, you should probably sleep. And I'm like, well, this hot woman wants me to be in bed more. So I was like, hey, that's a good idea. Right. And then I was like, oh my God, when I actually sleep between 7.5 and 9.5 hours, and preferably for me, my body really likes right around 8.5 hours. Game changer, brain wise, inflammation wise, every aspect of my life, I'm on point when I get a little over 8 hours of sleep. But that's like actual sleep time. So I think that's great. So I'm going to keep eating my greens. I'm going to be sleeping a lot. Anything else that's like really big that we can take care of?
Well, again, I think something that anybody can do, regardless of your fitness level, economics, and so forth, is move your body. We are designed as humans to move, and movement for some people may be very limited for any number of different reasons, or it may be, something extreme you can do. But our bodies need to move. You're moving the lymph, you're moving your blood, you're bringing more oxygen, more nutrients to your tissue that maybe needs to be repaired. So, when I was in the throes of Lyme and I was exhausted, any exercise seemed impossible. So I would literally plop in front of the couch and I would stretch. And that's kind of what my body could do at the time. But there's still value in that. And it didn't feel like much, but over time, I developed a point where I was able to walk more and then start exercising more. So you need a place to start, particularly if you're someone who really hasn't done any type of movement. And I hear people say, well, I'm a parent, I chase my kids around all day, I'm moving. I'm like, yeah, but it's movement with intent. And I think that's important too. So, have something that you do routinely. And again, it's got to be something you enjoy doing. If you really hate doing it, there's a good chance you're not going to do it. So, pick something you actually enjoy doing. And I have some people who bounce on a rebounder, people who love running, people who love cycling, people who love hiking. Again, I don't think it matters as much what you do. It's just the commitment to doing something, doing it regularly, and, making that part of your daily life.
Well, I think going back to what you said, even about burn off back, about the mindset pieces, and it kind of it kind of brings a lot of stuff together, is I think you do have to do it with a purpose. And that purpose should be clear to you. And it's like, one, I think you need to make me time. I cannot take care of myself. And if I can't take care of I should say, I can't take care of other people in my life if I don't first take care of myself and love myself and give me what I need. And as parents who are busy, that might be, I have 90 seconds of me time a day, but I can guarantee you there's going to be a difference between no me time and 90 seconds of me time where you do that. And it might be that when it's time to go chase your kids, you set that mindset. And I just, the whole time we've been talking, I just reflecting on some of the things that like we've gone through with burn off and stuff and all our adventures out there, but in these programs. But when you started off talking about fear, it's just like, I remember the Tony Robbins quote, like, fear is like, false evidence appearing real. And we see that everywhere. But, is there something out there that you were fearful of, that just kind of like you realized, like, I'm having this physical reaction, but it's really not serving me anymore? Like maybe in the moment when it first happened, it was, but later on, it doesn't serve me anymore, and it's time to move past it because it really is not real evidence.
Yeah, I mean, I think we all have experiences like that. And I think the biggest thing with fear is the fear of unknown. And I think that's what's bothering a lot of people now is, we don't know where this is all leading. We don't know how long the world's going to be kind of shut down. We don't know what's going to happen with our jobs. We don't know if our kids are going to be in school in the fall. So all of these unknowns is often what breeds fear. And I think, a lot of us just have to step back for a second, take a deep breath, realize, look, there's a situation going on right now. It will some point come to an end. It is a finite blip in our life, as inconvenient it is for every other purpose, but it will pass at some point, and we will get back to some semblance of a normal life. So, how can we best, again, take advantage of that time instead of just sitting there ruminating about all the things that aren't working well in our lives now? Where are those areas that we can take advantage of that and, again, improve it? And so if we can take a look at it from a positive perspective, you talked about the importance of, mindset, the body, mind, spirit. This is where that spirit part comes in. Is like, your mindset and how you still connect with people, finding those ways given the circumstances is still important. We're humans, we're designed to connect with each other. So we've got to find creative ways. And again, as the world starts opening up, we're going to have more human to human interaction again, which I think is good. But, we need to make an effort to find those ways to again, connect with each other. And, again, just take advantage of that time to certainly connect with your own family, at least.
Right. So kind of, I always like to keep this, we have to talk about the fear and the things that we don't understand and the real challenges out there. But you also used the term passion a moment ago. And to me, that's the thing, I find when you find what you're passionate about, you'll actually do it. I guess I'm wondering, what is your passion and what do you share when you're talking to people in the office to help them find their passion so that they can actually, have that passion that helps drive them to make these changes that they know are necessary?
Yeah, for me, I've been passionate about music. It's the one thing I really love. I'm a drummer. I've been playing drums since I was 13 years old, but it's a great outlet to have something that's not my, right brain that has to think all the time, or my left brain. I get to experience a different part of my brain. It's a physical exercise. Music for me, I find very relaxing. So it's, again, finding that thing for you. For some people it's art, for some people it's walking, for some people it's meditating. What is that thing, again, that you love, that feeds your soul? I think that's just as important in our process of healing. Being able to have that space where we really kind of go into that Zen moment. We really start to just chill out and kind of shut out these external things in our world, even if it's just for 10 minutes. We know from the research on heart math that it only takes just a handful of minutes to be able to kind of shut your brain off. That has such a big positive impact on your mental well-being. So, find that thing. And I think, when I talk with patients, I talk about the things that I'm passionate about. I love playing drums. I love music. I've recently started riding my bike again. I haven't ridden my bike in quite a while, and I've always
Nice.
enjoyed doing that. And we've got some great trails around here to ride in California. So I'm starting to get back in that again. Now I have a little bit more time to do it. So again, it's just finding those things that you really love and you're going to stick to it. It makes such a huge difference.
That's awesome, brother. That's the thing. It's just you find the thing. And I think that the other part about the heart math, for anyone who might not know, looks at heart rate variability, and it teaches you through biofeedback of how to use your breath to get yourself more calm. And there's way deeper than that, but it's really good for the parasympathetic nervous system and boosting immune function. But what's really interesting is that when you look at the heart math and the heart rate variability, and then you look at things there's different forms of eco meditation is a combination of EFT tapping and a meditation. You can do that for 10 minutes a day for as little as 7 days. And you can see a doubling in certain markers of immune system function. So all those things that you're recommending, Darin, I think are key. And I really love that it's what we put in our mouth, when we choose to go to bed, and what we choose to focus on, focusing on our passion and our families and that positive mindset are critical pieces, whether you're dealing with COVID-19 prevention or treatment, whether it's flu, common cold, Lyme disease, so great message, man.
Yeah, look, it's a tough world out there right now, and we can either rise up to the challenges that we face and overcome them and bring our friends, our families along with us, or we can choose to be a victim and suffer in silence and I think, most of us would rather choose the former. We'd rather, rise above the occasion, say, look, I understand this is hard for any number of different reasons, but there are things that I do have control over. And let me take that to my best advantage so that I come out, a better person after all this is over than I was before. And, why not, right?
Yeah, well, I got shit to do. I got shit I want to do. I want to be here, do things with my daughter. I can't wait till the next time we get to hang out in person. It's like I want to go play outside. Then that's the part about the passion is there's a place for me to go. I have a mission. I'm driven. I have personal and professional things I got it done. And so it is, it's like, it's like funny. As soon as you said that, I was like, yeah, man. And like, I can feel the energy welling up, and that energy that we feel when we get excited, that energy is felt throughout our body and supports our cells and energizes our cells. So that's the way we get it done, Darin. It's good shit.
Awesome.
Hey, so thanks so much for joining me. I mean, I always love chatting, and Darin and I do a lot of live things together, and we go on forever. So we're we're not going to torture everybody, but it's great to have a conversation where we can dive into this. And where can people find out more about you? Check you out. What's your website? Obviously, the book. Woo! I'm going to stop doing green screen. There you go. All right.
Yeah, so if people want to follow us, get information, it's just at dariningelsnd.com. And we'd love for people to join us, get all the information we put out there about how to keep you and your family healthy and safe.
Awesome. Yeah, and I'll make sure I post the links with the podcast and everything. So thanks again, Darin. And everybody, if you've check out Darin's stuff, it's great. I get different recipes and stuff. And the thing that's great about Darin is he's experienced a lot of these things, both as a professional and as a patient, and he lives this lifestyle. He understands it's not easy, but this is reality. When you do those hard things, it really makes a huge difference in your life. And you get his compassion and his passion and his personal experience coming through in both his book and all of his writings. So to me, Darin, all the work you're doing is inspirational because you're talking to us as a real person, and it's not all, glossed over. It's like real deep stuff, and it's real heartfelt. So thanks very much. And we'll talk again soon, man.
All right. Thanks, Tom.